This is just a notorious family for trafficking in heroin.
Right.
And it was a huge case. They were without a doubt the biggest suppliers of heroin to our area.
Our big story of the day, 2 Steubenville brothers convicted in federal court for running a heroin ring.
This was the result of a 3-year effort by several entities across our area. News 9's Lauren Healy joins us live now in Jefferson County. Now, Lauren, what does this mean for the Ohio Valley?
Good evening, Rich and Brittany. Now, this isn't just a big win for the dozens of investigators that worked on this case, but it's also a huge win for the Ohio Valley and the surrounding areas. You're taking a look at 37-year-old Frederick McShann and 42-year-old David McShann. The duo was convicted by a United States District Court jury on Friday, both convicted of a laundry list of charges. In the year-long investigation, law enforcement culminated 8 firearms, 3 vehicles, and approximately $110,000 worth of narcotics. This was all part of an effort that involved members of the Jefferson County Drug Task Force, along with members of the Hancock, Brook, and Weirton Drug Task Force. Those entities cooperated with members of the FBI and the prosecutor's office locally for the past 3 years. All resources were put together to bring down the organization, and prosecutor Jane Hanlon says it's a great sign of things to come.
We don't want them to bring that here. We don't want it coming here from Chicago, and we don't want it coming here at all. And so I hope this is the start of a new partnership between all of these organizations, because I think the results in this case show how absolutely effective that can be.
David and Frederick McShann face 10 to 40 years in federal prison. They are currently being held in a federal prison in Columbus. Now, they will be sentenced within the next 60 to 90 days. We'll continue to follow this case and bring you the very latest on air and online. Now, coming up on News 9 at 10 on Fox 9 and News 9 tonight, we'll break down the other 4 co-defendants in this case and also what this means for the Ohio Valley. Reporting live this evening, Lauren Healy, News 9 at 6.
There is a killer lurking on local streets. It goes by several names, but police know it best as fentanyl. The CW55's Catrice Nolan has more.
Here at the Crestview Police Department, Chief Tony Teller tells me there is a killer on the loose.
That killer, a synthetic opioid laced with fentanyl, and it has killed 3 people in the area in the last 3 months, and the other 3 have had a close call.
The suppliers of the drug, they're the killers.
And now police are looking for those people.
We're here, we're trying to get it stopped. That's our main goal with it, is trying to get it stopped.
It's a drug that's 100 times more potent than heroin.
And it seems to be targeting young people in the area, one victim as young as 23 years old. It's not just hitting Crestview. The drugs are also a problem in the Mobile area. Just last month, 2 local doctors were found guilty on charges related to a pill mill bust that was a part of a raid in 2015 called Operation Polluted. The pair were making millions of dollars by overprescribing pain medications like fentanyl. And police in Crestview hope to catch those lacing and supplying the deadly drug.
And it's very toxic. It stops your breathing. It affects your respiratory system. And if you don't act immediately, in most cases, it results in death.
Reporting in Crestview, Catrice Nolan, the CW55 News at 9.
And those pain doctors in Mobile are scheduled to be sentenced in May.
Opioid epidemic running rampant, in fact, claiming an average of 91 American lives every day. But what's worse, some doctors are cashing in on this epidemic, prescribing addictive opioids to patients that have not only they've never examined, but in many cases they've never even met them. I mean, it's all a ruse to make money off of patients' despair. Here to discuss, Dr. Mark Siegel and Scott Brown are back with us. Dr. Siegel, a lot of criticism aimed at your industry, the drug industry, for its role in what's become a crippling epidemic in this country.
Charles, I blame doctors for this. Look, almost half of the people that are prescribing opioids are primary care doctors like me, family practitioners or internists. And you know what? They're not prescribing it for the right reason. Somebody comes in with back pain, it's acute, they get the patient started on something, they end up continuing it. Did you know, Charles, that 70% of the Vicodin prescriptions in this country are actually taken ultimately by someone that it wasn't even prescribed for? So it becomes a medicine cabinet issue. And then, get this, 4 out of 5 people who end up addicted to heroin start off with prescription opioids. Their prescription runs out, somebody won't refill it anymore, and they go to the streets and they get a brown bag. Then the borders are porous, you see it pouring in. So I'm really, really happy to see this administration about to focus on the opioid epidemic.
Let me ask you, though, Dr. Siegel, though, the doctors, are they acting ignorant to the fact that they're contributing to this? I mean, is there any way to get some honesty from the industry, from your industry, because a lot of these doctors have to know these statistics that you just shared with us?
Charles, 2 points. One is some of these doctors are actually nefarious. One doctor in New Jersey literally prescribing 60,000 pills to patients he hasn't even seen, as you said. 31 are under investigation. But the larger problem are physicians that don't understand back pain. They're busy giving opioids, you know, to things that you should be using muscle relaxants or physical therapy or other medications or even chiropractic or maybe using many different modalities. That's really the way to go. Acupuncture is something that works. You know, doctors like me will rush to surgery or will rush to opioid prescriptions. That's a big problem. Some of it's ignorance, and some of it is, as you said, for the money.
Some of it's nefarious. Scott Brown, of course, President Trump, then candidate Trump, swung through your neck of the woods and sort of discovered firsthand just how awful this is. And, you know, for me, I think that on the economic side, this is also a sign of hopelessness amongst a lot of Americans.
Well, there's no doubt, Charles. I think you've nailed it. Overprescribing is nothing new, and if the doctors don't self-police, then you're going to have law enforcement and political folks step in and police for them, and then that's not going to be a good thing for doctors. You see it in the VA, and Charles, as you may or may not know, here in New Hampshire, Governor Sununu has really went after the city of Lawrence, indicating that that's where a majority of the drugs are coming from specifically. And what is it leading to? It's leading to also to human sex trafficking, because a lot of the people who are now hooked on these drugs are in fact selling themselves to pay for the drugs. So it's not only leading on a drug epidemic, it's actually, I think, obviously stimulating and increasing the amount of sex and drug trafficking, people trafficking, and that's obviously not a good thing for anybody.
Charles,
real quick, Doc.
One more thing is that there's more federal laws, 600 that are coming out. In New York State, they have a system called iStop where we have to do everything online. We're tracked. And that's cutting down dramatically. We have to be patrolled physicians. Yeah. If we don't do it to ourselves, they have to do it to us.
Yeah, and also, you know, that's why I love the jobs report on Friday, because it was about goods producing jobs, mining, construction, manufacturing. Those are the places where dads lost their jobs, and those are the broken homes where a lot of this comes from that people never talk about. But you connect those dots, and it means a lot. Guys, thank you both for your expertise. Appreciate it.
Big message out there for folks in the community. A message coming from the ME's office here in Palm Beach County. I want to share you what that message, it was a tweet that was sent, and that tweet reads, "Thought there was a slowing down, but we have 10 drug overdose deaths today. Must be a bad batch of drug out there. You've been warned." Now, we already know the number of drug overdose deaths continues to grow, not only right here in South Florida, but around the country. And according to experts, new numbers show 1 in 4 drug overdoses in 2015 related to heroin. Back in 1999, experts tell us just 6% of all overdoses were related to the drug. And they believe people may be moving on to heroin because of the cost and the crackdowns on illegal use of prescription drugs. Now, I don't have any specific details about the 10 deaths today. We did try and get an interview with the ME, but we were told he's busy and not available at this time. But we will have time to talk with some of the task force officials. They'll be meeting in about an hour today, and we'll have much more in this story starting tonight at 5. Reporting live in West Palm Beach, Angela Rozier, WPBF.
A new implant device is front and center in the fight against opioid addiction. The FDA recently approved the device to help addicts wean themselves from heroin and opioids such as hydrocodone and oxycodone. The device will be used as a medication-assisted treatment, which, in conjunction with behavioral therapy, will help with an addict's recovery for a period of 6 months. The device is implanted in the arm and releases a medication meant to cut cravings and prevent withdrawal symptoms. Up until now, that medication has only been available in pill form. Advocates say the device will make sure patients don't miss their dosage, or worse, have their prescription end up in the hands of a recreational user. The FDA sees this first-of-its-kind treatment as a major step in reducing opioid dependence and overdose. For today's Health Minute, I'm Andy Rose.
Smith is accused of shooting up Friday night while she was babysitting 2 Santa Fe kids. According to a criminal complaint uncovered by KOAT, Smith was babysitting 2 children, 2-year-old Angelina Valenzuela and 3-month-old Jonathan Valenzuela. Jonathan wouldn't survive the night. According to the complaint, Smith injected herself with heroin 3 times throughout the day. At one point, she and the children fell asleep. The complaint says later in the morning, the 3-month-old boy woke up and started gurgling and reportedly had milk coming out of his nose. Smith told investigators she repositioned the baby and went back to sleep. When she woke up, the boy she was babysitting wasn't moving. Yeah, the babysitter reportedly told investigators here at the Thunderbird Inn that the child involved was her child. That added an obstruction charge to the endangerment charge she already faced. Smith was arrested, charged with endangering a child's life or health. Today, Smith faced a judge who ordered her held on $50,000 bond. Reporting in Santa Fe, David Carl, KOAT Action 7 News.
Yeah, Milwaukee Police, West Allis Police, and undercover officers from the Drug Enforcement Agency were conducting a big investigation on a known drug dealer when shots were fired right down the street here. We don't know where this investigation started, but it ended here at 19th and Stark with the suspected drug dealer dead. Chief Ed Flynn would only say the officers who engaged this man were in plain clothes. It's unclear if the suspect was shot and killed in his car or was running away from police.
Upon approaching the vehicle, they were confronted by an individual with a firearm in his hand. Shots were fired. We will not know who shot how many bullets until the firearms are examined of both the suspect and the officers.
Now, no officers were hurt in this deadly shooting, Joyce.
Christina, who's leading this investigation since state law prohibits a police agency involved in a fatal shooting from investigating itself?
Right, the Milwaukee County Suburban Investigation Team is on scene. They're the ones leading the investigation, and I'm told that no officers from West Allis or Milwaukee are part of that group. We're live at 19th and Stark. Christina Palladino, WISN 12 News.
Thank you, Christina. Now, the police barriers kept our crews on the ground about a block from the scene, but News Chopper 12 was able to get a look from the air.
And 12 News' Matt Salemi described what he saw.
A heavy police presence at 20th and Stark. Officers investigating. About midway up the block, there is a squad and another vehicle. It looks like the other vehicle went up a snowbank, possibly struck a tree. That's the area where the heaviest investigation is taking place. Officers searching around the area with flashlights. In News Chopper 12, Matt Salemi, WISN 12 News.
High Point Police tell me they're going to take a 3-phase strategy in reducing crime in their city, and it's a pretty simple one. Find the people responsible and give them a warning to stop what they're doing, or they're going to be arrested. They've already made half a dozen arrests so far, and police tell me they are far from over. Here's a look at the letter High Point Police have been circulating throughout the community. It discusses the increase in violence this year. The letter says police will be giving certain people special attention until the violence comes to an end. I had a look at some of the crime data, and here's what I found. Compared to last year, armed robberies are up 325%. Assaults involving a gun are up 135%. Police say a very small group of people are responsible for the sharp increase in crime. They found that most of it is drug-related and linked to heroin specifically. High Point is on pace to have at least 300 heroin overdoses this year. That's compared to 191 last year and 77 the year before. Police say most of these crimes are in retaliation to another, so they have this message for the people responsible.
We will back off when the shooting stops, and not until. So if you want to get this police attention off you, if you're in this drug market and you're involved in this violence and you want the attention to stop, put the guns down and stop the shooting.
Police say they will be aggressively entering the final phase soon, where they will be looking at gun investigations and gun assaults. They plan to make a lot more arrests throughout this initiative, and they're going to be concentrating their areas on the high crime spots that they've identified in the city. Reporting live in High Point tonight, I'm Janae Lewis for WXII 12 News.
According to the Madison Police Department, the number of heroin overdose calls has skyrocketed in the past few years.
Health experts say treatment opportunities are there, but not being used. Our Carrie Larson found out why this has become such an epidemic in our community. She's in the newsroom with more details tonight. Carrie?
Eric and Susan, the statistics on overdoses from the Madison Police Department are pretty shocking, and recent numbers show the problem is only getting worse.
The addiction of heroin completely consumes and overtakes somebody.
Madison police warn the addictive drug is hitting Dane County hard.
3 years ago in 2013, we're at 158 reported overdoses. And then last year in 2016, we're at 459 overdoses.
Officer Dan Swanson tracks the number of overdose responses daily and says the department has already received 50 calls this year. 3 were fatal.
We're only in March right now, but if I look back at March of last year, for instance, January to March, I would say we have more at this point than we did at that point.
So what's causing the spike in users?
A lot of people point back to just the availability of pain, narcotic, prescription drugs.
Medical Director for UW Pain Services, Dr. Al Abdel Sayed, confirms that's a large part of it.
I think there should be awareness among people and healthcare providers about keeping things in balance, not going an extreme of either over-prescribing or under-prescribing.
He says it's also because of just how addictive the drug is.
Some people think, I will do it once or I'll do it twice, and then even people going for treatment with all their will, but sometimes it's hard.
Several healthcare providers like UW Health are working with law enforcement to find a solution.
Something has to change. What we're doing is not working.
They hope new programs will provide some relief.
Education, of course, cutting down the source of those drugs so they are not easy to obtain.
Any little bit helps, yeah. Every life you can impact and get a treatment is a life saved.
Dr. Al told me they are regularly working on new treatment plans, but many heroin users are not seeking recovery, and even if they do, he says they do typically relapse. Madison Police is hoping to help with that, though, through their new program called Madison Addicts Recovery Initiative. Eric and Susan, I will explain more about how that program works on News 3 at 6.
All right, we look forward to learning more.
Operation gets busted in Providence. Last night, police arrested 24-year-old Brian Corderial during a traffic stop following a month-long investigation.
Today, the department showed off the goods they recovered from the bust, including 3.5 kilos of cocaine, 3 kilos of fentanyl, and more than 600 grams of heroin. Police also recovered a gun and a kilo press, which is used to crush up drugs in order for dealers to make a large profit.
He was a major dealer, trafficker, and we're fortunate to get him off the street.
So this is significant. These drugs would have hit the street of Providence or throughout this entire region in Rhode Island.
Public Safety Commissioner Stephen Perry praised the Intelligence and Organized Crime Unit, which was formed in 2015 to target large drug traffickers. Meantime, Major David LePayton says that there could be more arrests coming.
Amazing father. And I know that he's going to miss out knowing him.
Tammy Pitts is keeping her son's memory alive as she and her grandson's mother work to give this little guy the best life possible.
Him and Cannon obviously taking a nap right after Cannon was born. He was a newborn. That's a beautiful picture.
Her son, Zach Ziem, died from an overdose last April. The 24-year-old left behind a baby boy, Cannon, who was only 10.5 months old at the time.
He is gravely missed, especially by his mother.
Zach fought heroin addiction and was sober for nearly 3 years, 4 months.
He relapsed and did what he thought was heroin one time, and it was laced with fentanyl, and he died.
Zach's girlfriend, Cannon's mom, works to stay sober each and every day, and she helps others find recovery at her job. Pitts helps support her and Cannon.
I watch Cannon 2 or 3 times a week while she works. I'm her biggest fan and her biggest cheerleader.
Grandparents, aunts, uncles, and others are becoming parents again in the midst of the heroin epidemic. Neonatal experts at Norton Healthcare say since 2000, the number of infants born with withdrawal symptoms at Norton Healthcare has increased by 50%. And family court judges say dockets are being added each year to handle an explosive number of cases linked to the heroin and opioid epidemic. For Pitts, she says it's her mission to keep her grandson safe, healthy, and to make sure his father's memory is kept alive.
He carries that spirit around with him, so we're really blessed to have him. I would rather have him here, even in the sorrowful circumstances, than not have him.
Ann Bowden, WLKY News.
According to Children Incorporated, at least 60,000 grandparents in Kentucky are raising their grandchildren.
And not need it, then need it and not have it.
Oldham County High Schools now stock Narcan, the drug used to reverse an overdose. Jonathan Wasaba says the district has not seen heroin use among its students, but they want to be prepared. It's a sentiment shared by the Kentucky Harm Reduction Task Force.
What we're really concerned about are outside events that may happen at the school. Okay, you got basketball, football, you got all kinds of things that bring all kinds of strangers and all kinds of people onto your campus. We want them to make sure that they are prepared in case somebody does do an overdose.
The heroin and opioid epidemic is exploding, including among teenagers. According to the Centers for Disease Control, more than 4,200 people between the ages of 15 and 24 died from an overdose in 2015. That's compared to nearly 3,800 in 2014. Russ Reed says addiction usually takes place between the ages of 12 and 17 years old. That means children as young as 7th grade are at risk.
When the adolescent brain develops, it doesn't develop fully until the ages of 24 to 25 years old. So basically the adolescent brain has all the information in it to say, go, try this, do that, develop, be the best you can possibly be. Unfortunately, it doesn't have the no part in it yet until it's fully developed.
While Oldham County is not seeing heroin among its students, they continue to battle lower-level drugs and alcohol.
Voluntarily, we do drug testing. We also do drug testing for any student randomly. They're put into a pool for any students that are in extracurricular activities, sports, extracurriculars. And then parents are also, it's made available to parents if they want to have their child put into that pool and then randomly selected. We do have random drug tests.
Reed believes education is key to fighting the drug epidemic.
We got to start in the elementary schools, and we got to continue that education in the high schools. So the more information they know, and the more they know about the consequences, and the more they know that even though marijuana is legalized in some states, it's still a very addictive drug.
And the U.S. Office of Adolescent Health says that by 12th grade, about half of adolescents have abused an illicit drug at least once. Jennifer Bayless, WLKY News.
Thanks, Jennifer. Proposed House Bill 145 is making its way through the Kentucky legislature now. The bill would require schools to educate students about drug addiction and abuse.
Last year, we introduced you to John Michael Myers. 2 days before Christmas in 2015, he overdosed on heroin. Paramedics revived him 3 times before, but this time, his heart stopped.
It was scary. Definitely one of the scariest things I ever went through in my life.
Myers knows firsthand the benefits of Narcan, an overdose-reversing drug which saved his life. Tom Duddy is with Adapt Pharma, the company that makes Narcan.
It's definitely saving lives. We hear it every day.
Adapt Pharma paid for a study released today which looked at more than 150 organizations that used the Narcan nasal spray since last August. WESH 2 was only provided a summary of the findings, which the company says found of 245 uses with known outcomes, 242 opioid-related overdoses were reversed. 95% of those cases involved heroin, 5% fentanyl. In 125 out of 170 cases, the company says patients were revived in less than 5 minutes.
It was a very pleasant surprise.
Dr. George Avadian is the senior medical advisor for Delaware County, Pennsylvania, and evaluated the data.
The study tells us that in the field, nasal Narcan saves lives.
No longer just carried by paramedics, last year Orlando Police and Orange County Sheriff deputies began carrying Narcan with them, a tool Myers credits, along with rehab, for keeping him alive.
I'd be dead.
Matt Grant, WESH 2, the News Hour at 10.